Struggling with blood sugar spikes? Surprised at how even a healthy diet sometimes misses the mark? It's not just you. Millions of seniors face the same challenge. Discover the top vitamins that can help keep your glucose levels in check, enhancing your energy and confidence in daily life. Top 7. Safe vitamin supplements for better glucose control. Number 1. Vitamin D. Research has increasingly highlighted a connection between low levels of vitamin D and an elevated risk of developing type 2 diabetes. This suggests that making sure you have adequate vitamin D could be a proactive step in diabetes prevention and management. You see, if you don't have enough vitamin D, your body might be less efficient at managing blood sugar. Vitamin D plays a really crucial role in how your body uses insulin. That's the hormone responsible for regulating blood sugar levels. It's thought to enhance the body's sensitivity to insulin, meaning that your cells can more effectively take up glucose from the bloodstream, thereby helping to lower blood sugar. This is vital for maintaining glucose balance. Interestingly, the benefits of vitamin D supplementation have been particularly noted in individuals with prediabetes. Studies indicate that improving vitamin D levels in this group can sometimes help slow the progression to full-blown type 2 diabetes by supporting better glycemic control and insulin function. So, it's an important consideration if you're at an early stage of glucose dysregulation. Now, when you're thinking about supplementation, recommended dosages of vitamin D can vary. It depends on your individual blood levels, where you live, how much sun exposure you get, and any existing health conditions. Healthcare providers often suggest daily intakes ranging from 800 IU to 2000 IU, but you might need higher doses if you have a diagnosed deficiency. A blood test can pinpoint your specific needs. Safety is, of course, paramount with any supplement. While vitamin D is generally safe, taking excessively high doses over long periods can lead to toxicity. This can show up as a buildup of calcium in the blood, nausea, and kidney problems. So, sticking to recommended guidelines and talking with a healthcare professional is really key to safe supplementation. It's also important to be aware of potential drug interactions. Vitamin D can interact with certain medications, including some diuretics, heart medications like digoxin, and anticonvulsants. That's why discussing vitamin D supplementation with your doctor is so crucial, especially if you are on other medications, to avoid any adverse effects. Number 2, magnesium. Magnesium is a vital mineral involved in over 300 enzymatic reactions in the body, and these include reactions critical for glucose metabolism and insulin action. It helps insulin bind to its receptors and makes it easier for glucose to get into your cells, playing a direct role in how effectively your body manages blood sugar. There's substantial evidence supporting the use of magnesium supplementation for improving glycemic control, particularly if you have or are at risk of diabetes. Meta-analyses of studies have shown that magnesium can lead to modest reductions in fasting glucose levels and improvements in insulin sensitivity. This makes it a beneficial addition to diabetes management. What's quite interesting is that magnesium deficiency is fairly common, especially among individuals with type 2 diabetes. This deficiency can actually worsen insulin resistance and glucose control. Things like a poor diet, increased urinary excretion of magnesium due to high blood sugar, and certain medications can contribute to low magnesium levels. For safe supplementation, it's important to choose the right form and dosage of magnesium. Forms like magnesium citrate, glycinate, or malate are generally well absorbed. While the recommended dietary allowance varies, supplemental doses for glycemic support often range from 250 milliliters to 350 milliliters per day. However, Do be aware that high doses can cause digestive upset, like diarrhea. Just like other supplements, magnesium can interact with certain medications. These include some antibiotics, bisphosphonates used for osteoporosis, and diuretics. So if you are taking any prescription medications, it's essential to consult your healthcare provider before starting magnesium supplements to ensure it's safe and compatible. Number 3. Alpha-Lipoic Acid. Alpha-Lipoic Acid, or ALA, is a potent antioxidant compound that your body naturally produces, and it's also found in certain foods. Its powerful antioxidant properties help neutralize harmful free radicals, which can contribute to diabetes-related complications like nerve damage and oxidative stress. ALA has a notable impact on insulin sensitivity. Research indicates that it can enhance glucose uptake in cells, essentially mimicking some of the effects of insulin. This improvement in how cells respond to insulin can lead to better overall blood sugar management. Several meta-analyses and clinical trials have explored ALA's effects on blood glucose levels. The findings generally suggest that supplementation with ALA can lead to a modest but statistically significant reduction in fasting blood glucose and HbA1c levels, particularly in individuals with type 2 diabetes. ALA is generally considered to have an established safety profile for most users when taken at recommended dosages. For glycemic control, these typically range from 600 mg to 1,200 mg per day, often in divided doses. Some individuals might experience mild side effects such as a skin rash or an upset stomach. While ALA is safe for many, it's always wise to consult a healthcare professional before starting, especially if you have diabetes. Because it can lower blood sugar, there's a potential for hypoglycemia if you take it alongside diabetes medications. This might mean your medication dosages need to be adjusted under medical supervision. It may also interact with thyroid medications. Number 4, vitamin C. Preliminary research findings suggest that vitamin C supplementation may contribute to improved blood sugar markers in individuals with type 2 diabetes. Some studies have observed modest reductions in fasting blood glucose, post-meal blood sugar, and HbA1c levels. Vitamin C is well known for its potent antioxidant role in the body, and when it comes to diabetes, this is particularly relevant because individuals with diabetes often experience increased oxidative stress. By combating this oxidative stress, vitamin C may help protect cells and tissues from damage associated with high blood sugar levels. Dosage considerations for vitamin C can vary. For general health, the RDA is around 75-90 mg per day. However, studies investigating its effects on blood sugar have often used higher doses, typically ranging from 500 mg to 1,000 mg daily. It is important to note that the quality of evidence regarding vitamin C's direct impact on glycemic control is still developing. Vitamin C is generally considered safe for most people, especially when you get it from food or take it in standard supplemental doses. High doses, we're talking above 2,000 milliliters or more per day, can sometimes lead to gastrointestinal issues like diarrhea or stomach cramps. If you have kidney conditions or a history of kidney stones, you should definitely consult your doctor before taking high doses. Number 5, vitamin E. Vitamin E, a fat-soluble antioxidant, is recognized for its potential to support glycemic control, primarily by reducing oxidative stress. You see, elevated blood sugar levels in diabetes can increase the production of harmful free radicals, and vitamin E helps protect cell membranes from this damage. Several studies have reviewed the impact of vitamin E supplementation on individuals with type 2 diabetes. While the results have been a bit mixed, some research suggests that it may help improve insulin sensitivity and reduce markers of oxidative stress. This could potentially contribute to better long-term glucose management when combined with other therapies. The recommended dietary allowance for vitamin E for adults is typically around 15 milliliters daily. Doses used in studies for glycemic support have varied, often being higher. It's generally best to obtain vitamin E from a balanced diet rich in nuts, seeds, and vegetable oils, using supplements cautiously. Precautions are important with vitamin E supplementation. High doses, particularly above 400 IU per day, have been linked to an increased risk of certain adverse effects, including an increased risk of bleeding. This is especially true if you're taking anticoagulant medications like warfarin, so a consultation with a healthcare provider is essential here. Number 6, chromium. Chromium is a trace mineral that's believed to enhance the action of insulin, which, as you know, is a hormone critical to the metabolism and storage of carbohydrates, fat, and protein in the body. It is thought to improve insulin sensitivity, making it easier for your cells to take up glucose from the bloodstream. Its potential benefits for type 2 diabetes management have been a subject of research for many years. Some studies suggest that chromium supplementation can lead to modest improvements in blood glucose levels and HbA1c, particularly in individuals who may have suboptimal chromium status. Relevant studies have investigated various forms and dosages of chromium. Dosages typically range from 200 to 1,000 mcg per day. The response to chromium can vary, and it may be more effective in individuals with poor baseline glucose control or chromium insufficiency. Best practices for chromium supplementation involve discussing its use with a healthcare provider, especially since its efficacy can depend on individual factors. It's generally considered safe at recommended doses, but you should be aware of potential interactions with medications like levothyroxine or NSAIDs. Number 7, omega-3 fatty acids. Omega-3 fatty acids, which are primarily found in fatty fish like salmon, mackerel, and sardines, as well as in flax seeds and walnuts, are well known for their potent anti-inflammatory benefits. Chronic inflammation is often a feature of type 2 diabetes and can contribute to insulin resistance and other complications. Their positive impact on overall metabolic health extends beyond just inflammation. Omega-3s can influence lipid profiles, potentially lowering triglycerides and improving cholesterol levels. Recent research has also begun to explore the direct suggestions of omega-3 fatty acids on glucose regulation in diabetes. While the primary benefits have traditionally been seen in cardiovascular health, some studies indicate that omega-3s may play a role in improving insulin sensitivity and could have a modest beneficial effect on glycemic control. For supplementation, dosages often range from 1 to 4 grams of combined EPA and DHA per day. It's important to choose high-quality supplements that have been tested for purity. And, as with other supplements, discussing omega-3 use with a healthcare provider is advisable, particularly if you are on blood-thinning medications, as omega-3s can also have a mild blood-thinning effect. Other key considerations. It is crucial to emphasize the importance of individualized care when considering any vitamin supplement. What works for one person may not work for another, and your specific health status, existing conditions, and nutritional needs must be taken into account. Always consult with your healthcare provider, such as your doctor or a registered dietitian, before starting any new supplement regimen. They can help you determine if a particular supplement is appropriate for you, recommend a safe dosage, and monitor for any potential effects. Be aware of potential interactions with medications you are currently taking. Many vitamins and minerals can affect how medications work, either by increasing or decreasing their effectiveness, or by heightening the risk of side effects. A healthcare professional can help identify and manage these interactions. It's also important to consider potential adverse effects of supplements themselves, especially when taken in high doses or for extended periods. While many vitamins are safe when used appropriately, they are not without risks if misused. Remember that while vitamin supplements may offer support for glucose control, they are not substitutes for prescribed medical treatments. A healthy, balanced diet, or regular physical activity. While certain safe vitamin supplements may offer modest support for managing blood glucose, their greatest impact is often seen when thoughtfully integrated with medical guidance, a nutritious diet, and consistent exercise. The evidence currently appears strongest for vitamin D and magnesium, though individual results can vary. If this guide was helpful in your journey to better glucose management, please consider sharing it with friends or family who might also benefit. Subscribe for more health tips, or leave a comment below with your experiences using vitamin supplements.